In this condition, the immune system of your body, which is supposed to help you fight infections and any other foreign attacks to your body, actually thinks that your thyroid is foreign to your body and so starts to attack your thyroid gland. And as a result, your thyroid gland is unable to make enough T4 and T3. So if this condition is not recognized early enough and as a result is not treated in pregnancy, the symptoms that you will start to experience include fatigue, weight gain, cold intolerance. And that essentially means that you feel cold when other people feel warm or feel that the temperature is normal. Dry skin, dry hair. Your doctor might say to you that your heart rate is actually slower than it should be. For some ladies who have hypothyroidism, they may actually start to experience hair loss. And finally, another symptom that you may experience, and you might just put it down to pregnancy, but it's actually because your thyroid gland isn't working properly, and that is constipation. Constipation is very common in pregnancy. However, if it is consistent and not responding to laxatives, then think outside of the box. Could this be hypothyroidism in pregnancy? The second type of thyroid disease that can happen in pregnancy is hyperthyroidism. And this type of thyroid disease is simply characterized by an excessive production of the thyroid hormone in pregnancy. The most common cause of hyperthyroidism is Graves' disease. In this type of thyroid disease, the antibodies, which are also part of our immune system, begin to stimulate the thyroid gland, resulting in this excess amount of the hormone that is seen in hyperthyroidism. So if you have this condition in pregnancy, what you'll observe is weight loss, heat intolerance, unexplained diarrhea, nervousness, irritability. You may even experience some tremors and feel palpitations. At the extreme end of things, some patients have also experienced trouble sleeping. Now that we know about the condition, the different types that they are, and the symptoms that you can experience whilst you're pregnant if you have this condition, I'm sure most of you are now more interested in what that actually means for you, your baby, and the pregnancy itself. Now, the risks I'm about to discuss will be the same whether you have hyperthyroidism or hypothyroidism in pregnancy. First, let's look at the risk to you as the mother. If you have thyroid disease in your pregnancy, you are at a greater risk of developing anemia, and that would simply means that you do not have enough circulating blood for both your baby and yourself. You can also be experiencing muscle pain and muscle weakness. A really serious complication of thyroid disease in pregnancy is heart failure. And finally, a rare but potentially life-threatening complication of thyroid disease in pregnancy is myxedema coma. When it comes to fetal health, both types of thyroid disease will cause development issues in the baby. And more specifically, that will include low birth weight and impaired neurological development. When considering the risk to the pregnancy itself, women who have thyroid disease are at a greater risk of experiencing miscarriages, preterm births, or preeclampsia. Preeclampsia is really high blood pressure in pregnancy that can lead to systemic organ failure. Now, for a second, let's look at the babies of mothers who have hypothyroidism.